Rob Whitley and I'm a professor of psychiatry at McGill University. I've been researching mental illness for over 10 years now. I'm particularly interested in how people respond to mental illness, what they do, what they don't do, what services they use, what services they don't use, what helps them, what hinders them, and with the aim obviously of trying to find out, to produce new knowledge which can help people. The recovery movement is a relatively new movement in the field of mental health and severe mental illness, and has become something of a paradigmatic movement in the last 10 or 15 years. In the middle and later half of the 20th century, there was a view of people with severe mental illness, and by severe mental illness I mean the most severe forms such as schizophrenia, schizoaffective, bipolar disorder, major depression. There was a view that people who had these illnesses were afflicted for life, that they would have a very nihilistic, pessimistic outcome. Really about what happened is in the 90s was there was a large body of epidemiological research that emerged from different countries which showed that recovery was something which could happen for people living with severe mental illness. There were 2 or 3 other influential dynamics which led to the emergence of the recovery movement. Another influential dynamic is the writings of people with severe mental illness. So there are numerous people who lived with a severe mental illness, such as Ellen Sachs or Kay Redfield Jameson, who then wrote very powerful and moving and poignant memoirs on recovery, on what living with a mental illness meant to them. There's been a third influential factor in recovery, which is the development of recovery-oriented services, or what are known as evidence-based practices sometimes. These are mental health services, usually of a psychosocial nature, which are have been shown to facilitate recovery amongst people with severe mental illness. So examples I could give you come from fields such as housing, employment, education. So we have these kind of 3 strands which have influenced the recovery movement. And then in the 1990s and the early part of the 21st century, there was the governments around the world started seeing this recovery movement, which was really consumer driven, was driven by people on the ground with mental illness who were saying, we demand better services. We don't want to live a life in an asylum, in congregate housing, going to day treatment centres, sitting around all day doing nothing. That governments saw this, and researchers marshalled their evidence and started officially sanctioning recovery as something which governments should support. If you ask me the question, what is recovery, there's various answers. There's no consensual shared definition of recovery. So different scholars and different members of the mental health consumer movement and different professionals use the term differently. If you look in the government documents, how they define recovery, it's really a lot about community integration, about having a job, having living in the community, not living in an asylum, living in independent housing, having good social relationships, having the things that most people in society take for granted. Many people have commented in the intellectual community that if there's not if there's not a shared definition, it's very hard to operationalize and enact in practice. And then is it just rhetoric? What is the reality of recovery? So in order to try and bring some clarity to these, the lack of definitional certainty in this field, myself and my colleague, Dr. Bob Drake, wrote a paper where we proposed a dimensional model of recovery, where we proposed 5 dimensions. The 5 dimensions are clinical recovery, existential recovery, physical recovery, social recovery, and functional recovery. Clinical recovery is basically the remission of symptoms, trying to reduce positive symptoms and trying to eradicate negative symptoms. Existential recovery really refers to regaining a sense of purpose and meaning, and perhaps spiritual or religious sense of spirituality or religiosity, which some people are searching for, and which they might lose when they have a psychotic break, for example. Functional recovery refers to fulfilling the functions that most people take for granted, living as normal citizens in society. This means having a job, living independently, which again is in contrast to previous models where many people with severe mental illness were homeless or lived in congregate housing or didn't have a job. Physical recovery refers to trying to enhance the physical health of people with severe mental illness, who often as a consequence of lifestyle or of poverty or of being on psychiatric medication will put on weight, will eat unhealthily, will smoke, will take drugs, and that's trying to help people in those areas make a better physical state of health. Social recovery refers to the fact that many people with severe mental illness will often lose family and friends when they have psychotic breaks or when they have manic episodes, and that they will, like everybody, humans are social creatures, they're looking for social activity, might feel a need to regain some of their friendships or to make new friendships or to reconnect with family. So that model of recovery is something that I've written about and that I've tried to promulgate to try and bring some clarity to the literature, and also to help people, clinicians and family members and people living with severe mental illness, think dimensionally about what they can do to help themselves or help others, or to assist in recovery. I think that one of the great insights and contributions of the recovery movement and the recovery paradigm is that it says that recovery is a process, not necessarily an outcome, and that it's a process of sometimes 2 steps forward, 1 step back, of ups and downs. But it's a process where, with the right supports, with the right attitudes, with the right social approaches, that can really help people in so many domains of life. But the people who do have a mental illness, and it might be ongoing, and they might occasionally have to use hospital or use more intensive services, can still have a great sense of recovery, can still have a good recovery. And I think it's for them to define those 5 dimensions that may be helpful, but there may be other dimensions which are important for them, that if somebody says, okay, I have schizophrenia, I've had it for 5 or 6 years, I'm trying to control it and I might have it for longer. For me, recovery doesn't mean reducing those symptoms to baseline, but I really would like to have a job, I would really like to live in this part of town, have a small quiet place with me and my dog or whatever. So I think it's important when we think about, when people say, can somebody recover completely, or can somebody be recovered? In a way, these questions are not important. The question is, what do people want from their lives, and what can we do to enhance that for them? I think the best way to understand recovery is to read the books of people who have experienced severe mental illness. So one I'd recommend is Ellen Sachs, The Centre Cannot Hold, to read the papers of people with severe mental illness. Patricia Deegan is somebody who's written very eloquently and poignantly about recovery, and to really, when you see things with your own eyes, that's when you become a kind of believer or convinced, or that something is right or can happen. And what impresses me about the recovery movement is the fact that it still remains, and was especially in the beginning, consumer driven by people with severe mental illness who were demanding better services, who had very negative experiences which they wanted to document and get out there, and believed in a better way, and then researchers and practitioners allied with them and became advocates together, and governments have seen that this can be a useful paradigm to help people in society. So for me, it's important to state that to learn about recovery, you can take a course in recovery, or you can watch videos by professors and doctors like me, but to really understand it, you need to interact with people who have experienced recovery in recovery, and then you can see for your own eyes.